put on the turf where the children would be playing, and it specifically said that you should avoid contact until it was dry, leaving about 4 hours. But if you look in the literature, it's clear that the half-life, which is the time it takes for half the compound essentially to degrade, it can be present for up to a month or longer. So I don't think 4 hours is adequate. In terms of medical community opinion, these are a list of the associations that are in support of cosmetic pesticide bylaws. So Canadian Cancer Society, Pediatric Society, Canadian Medical Association. I won't read the whole list, you can read them. I'd like to draw your attention to the lower two, number 7 and 8, the Shuswap Lake General Hospital, the Medical Advisory Committee, and the general practitioners. So fairly unanimous support throughout the medical community. And again, the Canadian Medical Association resolutions were August of 2007, so very recent. First of all, urging all levels of government, including municipal government, to show leadership from refraining from cosmetic use of pesticides and aggressively employing safer alternatives to the use of chemicals. Second resolution, August 2007, urging all levels of government to undertake a public education campaign to increase awareness of potential risks associated with these chemicals. And thirdly, encouraging all levels of government to promote safe and rational pesticide use by using the precautionary principle. And 3 years ago, they also called on the federal government to rescind the registration of the combined fertilizer pesticides, which are typically the ones that we're familiar with, the weed and feed. These are the herbicide, insecticide, fertilizer combinations that are commonly used and commonly spread in a granular form that is easily spread and picked up by birds and spread through the environment. The Interior Health Authority in February of 2007 put together a policy whose purpose was to protect staff, patients, and the public from these pesticides, and they have a policy in place to eliminate the use of chemical pesticides on hospital grounds. Organically grown flowers from my garden. And this is just a quick outline of my talk. In terms of the regulatory framework, the pesticide use in Canada is regulated by the Pest Management Regulatory Agency, which is within Health Canada, and considered analogous, in my mind, to the regulation of pharmaceuticals. They've published what's called the PACR to approve the pesticide, and they work within the legal framework, Consumer Products Act, which has been updated recently in response to a lot of public concern on this topic. They use animal toxicity studies and they estimate human exposure to calculate health risk. Unfortunately, it's very difficult to estimate human exposure because these are pervasive chemicals and they're mobile. They can be tracked into your house and they don't degrade inside the house because they're not exposed to environmental factors like sunlight and rain. And they also don't often consider that contaminants that I mentioned earlier, such as dioxins. From a physician's perspective, assessment is very much less rigorous than what we expect for pharmaceuticals, and I would say at a very low level of accountability and transparency in the review process. Unfortunately, we can't study these properly because we don't track pesticide sales and use, and we don't actually measure biological levels of these chemicals in our environment, and we have no reporting system for adverse effects, which would be all requirements for regulation of a pharmaceutical product. Now, I did do a literature review myself because I gave this talk to the physicians at the hospital, and I'll just let you know that I did a fairly exhaustive review through the College of Physicians and Surgeons library and looked at the Ontario College of Family Physicians did a critical appraisal of the literature from 1992 to 2004, in addition to work done by the Toronto Public Health Medical Officer. And I have references available if anybody's interested. In terms of the specific health effects, there are what I would call positive associations. Again, there are no perfect studies, but we see associations between household pesticide use and pediatric brain tumors. We see an association with herbicide exposure and breast cancer, exposure in the parent and kidney cancer in the offspring, and associations with pancreatic cancer and prostate cancer. And non-Hodgkin's is of particular concern. Its incidence in Canada is increasing at a rate of up to 1.5% per year. Out of the 27 studies that the Ontario College of Family Physicians reviewed, 23 showed a significant association between pesticide exposure and the development of non-Hodgkin's lymphoma. And there was a recent study, 2006, showing a positive association again with non-Hodgkin's lymphoma. and 2,4-D use in Italy. The chair of the Canadian Leukemia Studies Group, Dr. Richard Van, made a fairly clear statement. Recent studies make it crystal clear that 2,4-D used to kill weeds on lawns causes non-Hodgkin's lymphoma. That was a few weeks ago. He said that. In terms of leukemia, it's the 9th most common cause of cancer death in Canada. Of the 16 studies reviewed by the Ontario College, 13 showed a statistically significant association with pesticide exposure and leukemia. This is Quebec City. They have a province-wide ban now in effect banning use of these pesticides for cosmetic use. Genotoxicity, this is referring to genetic damage that can occur with exposure, and specifically what we call chromosomal aberrations. And these are a known biomarker for cancer risk, and there is an increased risk of these in pesticide-exposed subjects. Genetic risk, unfortunately, is hard to identify, but approximately 40% of the population are known as poor metabolizers, meaning that those of us who are, none of us know which of it who we are, but 40% of the people in this room may be poor metabolizers, and we are more susceptible to pesticides than other people. And there is a study in Montreal that showed that in poor metabolizers, 2,4-D use in pregnancy and childhood was associated with a 2-fold increase in leukemia in those genetics. In terms of the nervous system effects, we're ability of with Parkinson's disease, and probably more concerning is this very large area of neurodevelopmentality in developing fetal and brains in young children. I don't really quite know exactly what the effect is, but there are thought to be links with abnormal brain development. So just specifically to review for children, birth defects have occurred in pesticide-exposed fetuses. The developing nervous system is vulnerable. Children are more vulnerable because they're typically exposed. They tend to roll around, get dirt in their mouth, on their hands. And unfortunately, the issue of acute poisoning is still a concern, because if you go into a hardware store or garden center, you buy a bag of weed killer in a plastic bag, and it gets put in somebody's garage. And, really, it's not proper storage of these toxic chemicals. So, and because of Nemo's birth defect, that we're going to see I'd like to give credit to a couple of people who I used slides from, people in Ontario who are working on this issue. And this fellow was helpful. He's a professor of medicine at Ottawa Hospital and quite concerned about this issue. Thank you very much.
Thank you. For the record, I want to put in no, I don't use any pesticides.
Vegetable gardens, not that many would use pesticides these days in doing a food garden, but in your average garden, there are chemicals that would likely need to be identified. The more common thing of 2,4-D and its related.
I think different bylaws have taken different approaches. Many of them have a broad limit of pesticides. Some municipalities have specified the actual agents that they're concerned about. Others have used a broader definition. I think that's, a point for discussion for, this particular bylaw. But it wouldn't apply to food production. This is cosmetic use. So it's mostly really about the lawn care issue in my mind.
Councillor Canto.
Thhank you for your presentation. I think we're all becoming much more in tune with the effects of pesticides. One thing that Dr. Bell had identified when he spoke to us the last time was we talked about what alternative there would be, and how the places that sell pesticides, they need to supply some different. Do you know if that's catching on at all?
Well, I think so, particularly in Eastern Canada, a lot of the companies that have switched over to the more, less toxic forms of lawn care have actually shown an increase in business because they've been able to find alternatives. And again, I'm not an expert on those details. Other people in the audience would be, but there's options such as corn gluten, which is non-toxic, and people use the staff will go into this, I think, in terms of using the super concentrated vinegar options. These are all non-accumulated substances in the environment. And I do know that the lawn care companies in Halifax have actually increased business by using alternative methods for people.